Hello, I am Dr. Neto Pignataro, and I would like to once again thank the organization of the Congress, Science, Information and Spirit for the opportunity to share this lecture with you all, in which I will talk about lifestyle and oral physiology, the connection of teeth, the importance of teeth to systemic health, and also discuss a bit about masticatory function for the audience who are not dentists, for every health practitioner, so that you can have a better understanding of the importance of the masticatory system, the masticatory function, with systemic health, and also for, in evaluating your patients, being able to refer your patients for dental treatment suitable, specialized, when you detect that the function, masticatory or oral homeostasis, is not adequate, and that it is important for the patient's balance. Very well. Then, in other lectures of this Congress, I talked about oral pathologies, the influence of oral pathologies on systemic health, the measurement of health with BioWell, and also the dental tab, the relationship of teeth with organs and systems, especially in mouths, with tooth loss, with many restorations, with many prostheses made with various types of metal, causing galvanism in the mouth, and also the presence of chronic issues, chronic infections, abscesses, and cysts. Anyway, however, today I would like to talk to you more about mouths that appear to be normal, apparently healthy, but that often have an altered chewing function, thus impacting systemic health. Our friend Dmitry Orlov has recently launched the new lifestyle tab on the software BioWell system, which includes various parameters, among them nutrition, which is often at adequate levels, but in many times it is below than ideal levels, because organs and systems related to nutrition, to the digestive system, to the intestine, are out of balance. So today we are going to address not only the issue of diet, but also the masticatory function. In other words, the ability we have to chew and prepare this food so that later it can be digested easier and absorbed by the system. We have in our hands two paths. The path, more artificial, of technology, but one that brings us much comfort, many conveniences, and the possibility of living in developed centers, enjoying the best that technology has to offer, however, paying the price, which is often the toxicity present in the air, in the water, in the food, the stress of the city with high levels of dangerousness, oftentimes criminality, all of them stemming from our current. And we also have the option of connecting with nature, breathing fresh air, drinking pure water, living in places where stress can be better managed. But often we cannot have direct contact with the system. So we have to create our bubble, our space where we try to integrate as best as possible with nature, correcting eating habits, doing compensatory exercises, meditation, therapeutic practices, and so on. However, even by creating this microspace, balanced, we have to live with our thoughts and the reactions we have to the sensations that come into contact with our mind. Civilized way of life, which can be positive sensations or negative sensations, feelings of attachment, feelings of pleasure, and that trigger a series of biochemical reactions in our body, putting or taking our system out of homeostasis. Thus, the environment directly affects us, transforming our genetic load, our genotype, into a phenotype, which is the adaptation to paratypical stimuli, also known as epigenetics, how the environment shapes us, resulting in a phenotype adapted to this environment. This is the case, for example, of the chewing function. Hominids are, the Homo genus has been present on Earth for at least 4 or 5 million years. And during this period of development, in this evolutionary period, humans underwent adaptations resulting from the use of tools, such as flaked stones, the mastery of fire, which led humans to change the texture of food, making it less fibrous and causing direct changes in the stomatognathing system. However, only in the last 300 years, with the Industrial Revolution, there was a drastic change in the texture and composition of foods. Then the foods became food products with a reduction in texture and fibers of these foods. Thus, there was a direct impact on the development of the arches, which suffered pure atresia, lack of adequate stimulation, and atrophy, with crowding of the teeth, functional alterations, pathologies in the joints, pathologies in the teeth, resulting from the environment caused by the softening of the food. This is easily understood when we look at studies like those conducted by Kirozul in 1991, who compared Tanzanian children with Finnish children, and he found that Tanzanian children had much less malocclusion, occlusal variations, they had good arch development, good growth, whereas the Finnish children had more atresia, more crowding, more occlusal problems, arch alterations, crowding of the teeth, and we can think that this may be a result to genetic, to race, to the ethnic group, because we are comparing Tanzanians with Finns. However, when we compare the Finns from the 16th and 17th centuries, we see that those individuals from the 16th and 17th centuries, pre-industrial period, were very similar to the skulls of the Tanzanians, with a well-developed masticatory system, good arch development, little dental crowding, in short, once again showing the importance of the environment, of the masticatory function, and the use of hard and fibrous foods. In a study we conducted in the city of Piracicaba, Brazil, we observed the prevalence of malocclusion among public school students with an incidence of approximately 85%. 85% of children had some type of malocclusion, with crossbite and open bite being the most common. Very well, let's better understand chewing, the masticatory cycle, how the contact between the teeth works, and how this alters or interferes with the development of the arches. Very well, when we chew, the mandible, which is the lower part, the lower jaw, the mandible, makes a drop-like movement, opening and closing. So, we can see here, logically, the mouth open, the masticatory movement to grind the food. The bottom teeth move over the top teeth, similar to a grinding stone or a pestle, to break down the food. Then, we have an opening phase, a lateral phase, a closing phase, and, finally, a dental sliding phase, where the teeth slide against each other, causing then a dental contact that will grind the food. And during chewing, our temporomandibular joints move, both in the rotational movement and in the translational movement. Very well, so let's evaluate two types of occlusion here. In this type of occlusion here, you can see that the teeth slide and all the teeth touch each other. In the lateral movement, all the teeth touch each other. In this movement, you can observe that in the lateral movement, just the canines touch, while all the other teeth open up to the left and to the right, as you can see. So look at the space that opens. Notice that on the left side, there was a much greater increase in space, while on the right side, the space was smaller. See? So, there is a difference in space opening, in this case, between the right side and the left side. And who controls the movement in this case is the canine, while here, the movement is total, all the teeth touch each other. Can you see the difference? So, in your opinion, which mouth has the most capacity to better grind the food? Has any dentist ever asked you or checked on you these differences? Has any dentist ever asked you which side you prefer to chew on? because here there is a preferred chewing side. And if we observe the arch, we have here a deviation of the midline. So I have the upper midline and the lower midline, which is usually deviated to the side where the angle is smaller and the gap between the teeth is larger, this being the preferred chewing side, causing the jaw, little by little, to bend towards the side, functional to the preferred chewing side. Very well. So, we have two mouths with completely different functions, and the joint connecting the jaw and skull that moves forward and backward. This mouth, seemingly normal, even a beautiful mouth, when it moves to the side, it creates an angle here with a sliding motion and an opening between the teeth. Almost all the teeth touch here. When it moves to the other side, the opening is larger and this angle is greater. And the tendency is for the patient to chew on the side where the functional angle is smaller. The functional masticatory angle, planus, named after the dentist who discovered and developed it, called Pedro Planas, a Spanish dentist. So it's a mouth that has a preferentially unilateral masticatory function on the left side, as if it were a person walking with only one leg, or who preferably walked more with the left leg than with the right leg. And this causes functional implications. There are two similar mouths here, but when we slide them left and right, we notice that only the canines touch each other, as in that case, and then an opening occurs between the teeth, reducing chewing efficiency. This is known as a canine protection guide, regarded as suitable by orthodox dentistry, and it is also called organic gnethology. And here below we have a situation, as shown previously, where all the teeth touch, both on the left side and on the right side. Simultaneously, only the canine opposite to the chewing side does not touch. This is a proposal that has been created by neuroocclusal rehabilitation, which was developed by Pedro Planas, a mouth where we have total contact between all the teeth and greater chewing efficiency, considered by him as a balanced occlusion, a balanced mastication. And to test chewing efficiency, as I mentioned in the other lecture, we can use standardized elements for research, or even standardized carrot cubes, to assess the system's ability to fragment these particles. For once again I say, we are what we digest, not what we eat. And the size of the particles, as I mentioned in the other lecture, is very important to facilitate the digestive process. If we chew poorly chewed foods with excessively large sizes, we will slow down the digestion process and overload the digestive system, causing fermentation, reflux, among other pathologies, metabolic changes. This here is an indigenous woman from a Yanomami group who has never had contact with humans, so she has never eaten food brought by humans, much less sugar. Thus, the arches are well developed, and their food primarily consists of a native cassava flour, which is a root of Brazilian origin, a root that even contains a poison. But once they have chewed, the fermentation process starts outside the mouth. This cassava loses its poison and then becomes edible. So, cassava flour and also dried meat, smoked meat, taken from monkey, from paca, of capybara, and then dried in the smoke of the bonfire. It is a very tough and fibrous diet, thus producing well-developed arches. At the end of life, the teeth are very worn with the presence of tartar, but all the tribe members pass away, die with all their teeth in their mouths, well-developed arches, a function of natural balanced occlusion. So it was Pedro Planas who developed a work philosophy based on nature and the appropriate stimuli for the proper development of the arches, thereby producing a balanced occlusion with the capacity for good masticatory performance. As much as possible, the cause, the etiology of the problems are monitored from birth, evaluating the food that the child, since breastfeeding, natural breastfeeding, use of hard and fibrous foods as much as possible, and the rehabilitation of this masticatory system whenever an atresia or functional alteration is detected. So in this case here, we have the example of two children with malocclusion, where there is not a good relationship between the arches. If we observe the function, the attempt to slide the teeth, you can see that there is no proper relationship and that this child cannot slide the teeth, let alone have masticatory efficiency. So, it is not an aesthetic issue, it is a functional issue, which can be resolved very quickly with orthodontic and orthopedic techniques, so that the system is rehabilitated. So we see here the two joints and the upper arch with the teeth, the deciduous teeth. In Brazil, we refer to them as milk teeth. When the jaw touches here, as there is poor development of the upper arches, caused by habits, genetics, pacifier use, for example, there is an arch constriction and a poor dental relationship. So the teeth touch and the deviation occurs to the right or to the right or to the left. So here we have the lower molar bibuccal on the outside, while here we have the molar in an appropriate position. So this causes a deviation of the temporomandibular joint and an alteration of function, which can be corrected with the use of direct track resin or orthodontic appliances, which correct this malocclusion quickly, restoring proper alignment, centralization of the arches, efficient chewing, completely transforming the child's life. Often early on, without the need for appliances, just by applying resin to the teeth to restore the correct interlocking of the teeth, and restoring functional angles, which were previously unbalanced, to balance masticatory functional angles, thus causing appropriate movements and alternating bilateral chewing. This is what we studied in our doctoral research, evaluating the masticatory function of children aged 4 to 5 years with the computer-based kinesiography illustrated the movements of the mandible and the functional angles, unbalanced chewing angles. After using direct track resin, a therapy performed in 40 to 50 minutes, the arches were corrected and the chewing function restored. This was even published in health magazines. And children like this girl here, Deborah, whom we treated at 5 years old, a single 40 to 50 minute session was enough to solve the problem, which remained adequate throughout her life. Here she is 25, with well-developed arches, a balanced occlusion, just with the recovery of function, and also the use of fibrous foods that stimulated the stomatognathic system, thus restoring bilateral function of bilateral chewing. We achieved functional harmony and appropriate neural stimuli that also promote and provoke the integration of neural function, bringing numerous benefits to the patient. In the same way, demonstrating here that malocclusion or masticatory dysfunction can lead to cognitive declines during the individual's development and also in their senility. Moreover, occlusal deficiencies and occlusal disharmonies are also related to the appearance of beta amyloid in the brain, directly affecting or accelerating the development of Alzheimer's. So, here showing just a clinical case of a 15-year-old patient with endognathia, a mandibular atrophy. With a very large overbite, you can hardly see the jaw, and after treatment, a satisfactory mandibular expansion, restoring anatomy, aesthetics, and proper function, and most importantly, chewing efficiency. With alternating bilateral movements, a bilateral chewing, and an occlusal contact, a balanced occlusion. Besides the balanced occlusion and the condition of the teeth, we also have to consider the condyle, the temporomandibular joint, which, in cases like this boy's, often the condyle, due to the deep bite, is distalized, displaced functionally in the temporomandibular joint. So, after the correction of the teeth, we achieved a more suitable positioning of the temporomandibular joint, allowing space for the articular disc, which is the articular meniscus, as well as for the innervation and blood vessels of the distal bilaminar region of the joint. So, a joint with restored spaces, preventing pain, inflammation, temporomandibular joint disorders, tinnitus, and etc., and bringing much comfort and balance to the patient. Dr. Harold Gelb has a study where he evaluates muscle strength measured by kinesiography or by muscle tension measurements after the rehabilitation of the temporomandibular joint. The patient's muscle strength increases after the recovery of the joint space, just as there is a complete change in posture of the individual after the correction of malocclusion. Thus, there is a direct relationship between malocclusion being a captor superior that completely interferes with the tensegrity and posture of the patient. If we want to correct the patient's posture, in addition to the treatment of physiotherapy, chiropractic, or osteopathy, we have to find the cause. Whether it's in the feet, whether it's in the mouth, we have to correct the occlusion so that we achieve success and stability of the treatment. So, here is a case of deep bite, a patient with numerous prostheses, sought due to temporomandibular disorder and headache, and the occlusion was indeed found, with various prostheses and implants, but in a pathological situation of overbite, inability to chew, lack of masticatory function, swallowing, whole foods, and it also affected the entire neuromuscular system, with direct relationship with the individual's posture. So repositioning plates were used, restoring the vertical dimension, the occlusion height, positioning the jaw in a functional place, and also recovering the joint spaces. And then an immediate change in posture is noticed, as well as in bioelectrographic exams. Just as there is an increase in muscle tone, there is a significant increase in the overall energy level and balance of the energy when measured with the biowell. After a certain follow-up period, we continued the patient's evaluation, and after the elimination, the suppression of pain symptoms, balanced masticatory function, we can now rehabilitate this patient with prostheses in a functional position, in an appropriate posture, both of the joint and the teeth, as well as the entire body. Thus, by changing the position of the articular condyle within the joint cavity, we achieve a total balance of the system. For this, a repositioning technique is used, and after the condyle is repositioned, then here in blank, the old position of the condyle, compressing the bilaminar region, where there are vessels and nerves, and here in green is the new joint position caused by the use of appliances. That reposition, both the height of the teeth, the positioning of the teeth, and the temporomandibular joint. The patient uses this device for 3 months and then can be rehabilitated in a physiological situation. The positioning achieved with the appliances can be tested both with kinesiology and with bioelectrography, the biowell system, GDV. Thus, we can later restore the patient using prostheses in an appropriate position. Then, after determining the position, we wax these teeth to test in the patient's mouth the positioning, and then replicate these teeth in ceramic through the CAD/CAM system that can duplicate those crowns tested in the mouth and return the patient to a situation not only of aesthetics but also of proper function. In biological dentistry, just like in conventional dentistry, we have various types of rehabilitation materials: resin, ceramic polymers, zirconia, in short, various types of materials that can be tested, as well as adhesive cements. So there are cements with BPA, cements without BPA, glass ionomers, in short, a multitude of restoration products, also for cementation. And thus, we can utilize the selection of these materials using the principles of bioresonance from the biowell method, which, to achieve this, we use the stress test, which involves the use of both ring fingers, conducted and collected sequentially 4 times as a comparison parameter. And then we test each material by bringing it close to the thymus or holding it in the hands. And we observe the behavior for each type of material, with an increase or decrease in stress levels and an increase or decrease in energy levels. This is still experimental in nature. We are testing and conducting research so that we can use this methodology in the selection of dental materials. This is still a study that requires further evaluations, especially because we do not know in the long term what the impact is of dental materials, whether they are for cementation or for rehabilitation, on the balance and homeostasis during the lives of these patients. What would be the impact factor of these materials within our system? So, within the principle of bioresonance, we always consider the use of more compatible materials, more biological with the system. We also test mandibular repositioning to determine if this new mandibular position brings more muscle tone or an increase in energy level and balance, evaluated by bioelectrography. Another option of bioresonance within the BioWell system is the use of the one-finger test to evaluate the resonance of products such as frequency-based items, homeopathic remedies, or any type of materials to be tested. So here, in this example, this person showed their left thumb with a crack in the shine in the thyroid area, which is usually related to nodules, granulomas, cysts, or chronic problems. In this patient's case, there was a chronic alteration in the thyroid area, and the patient reported that she had cysts for 11 years in the thyroid gland. So, we select the thumb and perform 10 consecutive tests on the one-finger tab to assess the repetition of this to see if it wasn't sporadic. If this pattern repeats, it is because the problem is entrenched in this sector of the thyroid. Then we use the frequency medicine, which can be applied near the thymus, or sublingually, or even by holding the medicine bottle. And then, by conducting new tests, we determine which frequency or vibrational medicine that rebalances the sector, improving energy levels and reducing entropy levels. So, after the evaluation, the change achieved with the frequency medicine, 5 minutes after its use or immediately holding the medication, and then the statistics showing a trend. 2. Initially, that sector which was in excess in an inflammatory process, it migrated to a state of balance in a zone of homeostasis, green zone. Thus, we can rehabilitate our patient. We have several material options, whether they are resin, as in the first case here, where only resin was applied without any dental wear, thus maintaining the teeth in their original form, being minimally invasive and using composite resin. Or then lithium silicate ceramics, lucite, feldspathic ceramic, it doesn't matter. The important thing is to place the teeth in a functional situation and use materials compatible with occlusion and with the patient's biology. Thus, we rehabilitate the patient appropriately, bringing health and balance. Here is a case of a patient who returned after many years of having undergone orthodontics. We checked the occlusion. There was an occlusal imbalance with overload on the lower right second molar, tooth 47. We adjusted the occlusion, restored the balance, but we noticed a retention bar that is normally used after orthodontics. But since the patient's mouth was already well balanced, and we also considered the issue regarding the functional stimuli in the teeth, we noted in the other lecture that each dental group is related to an organ and system. The anterior and lower teeth are related to the kidneys and bladder, and the canines are associated with the liver. So, we proposed the removal of the bar. We removed the bar and conducted 2 tests without a filter before and 2 tests without a filter after the bar's removal. If we compare the parameters of the dental tab, we then observe that those lower teeth, both the canines and incisors, which were in a situation of excess, representing inflammatory processes, return to normal after the removal of the orthodontic retention bar. More studies need to be conducted with larger samples. We cannot draw conclusions from a few cases, but they would serve as pilot cases for research with a larger number of individuals. Also showing here, before and after the removal of the bar, that there was a decrease in those sectors related to kidneys, bladder, prostate, rectum, and liver. I will also undergo the experience. I have some postural issues. I have a deep bite with a change to the occlusal plan. So I will have the balancing apparatus that will restore my bite, also a deep bite with some degrees of wear. Then we restore the height. Relative to dental wear, we place appliance to develop the height, which will remain in the mouth for 3 months. After these 3 months, the planning is then done, and the rehabilitation proposal, based on the signs and symptoms, on the normalization of signs and symptoms. Here is a tomography for the evaluation of joint spaces. I have a loss of the distal space in the bilaminar zone, which is immediately recovered with the use of the appliance. So with the use of the appliance, we then recover the proper positioning of the teeth and the temporomandibular joints, and these changes are reflected immediately before and after the use of the appliance, with the recovery, both in terms of adequate levels of the teeth, especially of the teeth that have excess energy, as well as the normalization of most vertebrae and organs and systems of the body. Here we have the possibility to assess the direct impact of changes in the teeth as we conducted examinations before and after using the repositioning splint, both in terms of balance levels and overall levels. It is obvious that it is not just the use of the splint that will bring balance, especially since I am currently focused on improving my lifestyle, controlling stress levels, improving my diet, exercising, and generally maintaining an appropriate lifestyle, monitored mainly by the Lifestyle tab. So here I have comparative analysis of all my tests from the last 5 years, showing a profile characteristic of excesses here in the respiratory system, in teeth, maxilla, mandible, mostly in excess here, prostate on both sides here, and deficiency in cerebral and pineal circulation, and transverse colon. After the lifestyle change, the use of dental apparatus. Now following in the year 2025, we noticed an improvement in energy levels. Almost no deficiency touch, and only the excess levels in the teeth improved in the last 5 months, and also still just an excess in the respiratory system. But now I am focusing on trying normalize this sector so that I have epigenetic stimuli of balance, improving quality of life, well-being, and health. I would like to thank everyone for their attention. Feel free to send me questions, inquiries, and here I will leave with you my contact information, and I will be available to answer any questions. Thank you once again to the organization of work, especially Dmitry Orlov and the professor Konstantin Korotkov, for the invitation, for the opportunity to share with you our experiences.